Hi everyone, today's a special day. Our patient is my wife, Madalena. Madalena's 31 years old and she is the mother of two. She's blessed me with two children. My youngest child is almost 2 years old, so her last pregnancy was 2 years ago. She's here today because being that she's a fitness aficionado, she's struggling with getting her core to look like it was pre-pregnancy. Specifically, she's very low body fat and her diastasis is actually visible to some extent through her skin. So my plan for her is to do a version of a tummy tuck where I do the diastasis reduction or repair and remove some of the extra skin that she has. Now, she has had both of her children, our children, via C-section. So she already has a very low C-section scar, which in some patients can pose a challenge with the design of the operation and the placement of the actual incision. We're going to eventually use, and you'll get to actually watch the surgery live, a version of what I call a mini tummy tuck with a float umbilicus. And what that actually does is allow us to use a super low incision, which is great. It won't limit her with her choice of bathing suits or underwear. The scar should be concealed by most. But we're going to do our best to make sure that we place the incision so that it's relatively inconspicuous and that we preserve her belly button and actually improve it, because now, because of the pregnancy, the belly button has become effaced, and you're going to see what that looks like during her exam. What we're also going to do is map out the procedure on her right now, and you'll see how that translates into the actual procedure that we do in the operating room. So stand by, and what we're going to do is let her get changed, and then we'll proceed with the next part of our consultation, which is the actual physical exam and the surgical planning. So what we're going to do right now is have her stand up. We're going to map the procedure that we've talked about before. I can demonstrate how it's actually going to be planned. And then what you'll get to do is see this actually done in the operating room and get to follow her both preoperatively, intraoperatively, and postoperatively through her recovery, so you can get a better understanding of what this procedure involves. So let's have you stand up. Okay, you can take your robe off. Okay. All right, so when you look at her now, you see she's relatively low body fat. Can you tense up your abs? Okay. You know, she's got visible rectus musculature that you can see through the skin. What you see here is an effaced belly button. What that means is, as her pregnancy progressed and the baby grew, this pushed everything forward, stretched her skin, and her belly button that was originally an innie is now sort of a half and half, an outie and an innie. But what's really important when you look at this, stand up straight, what you see right here, and that's her diastasis. I have had countless consultations where patients bring up news articles that they read in newspapers or women's health magazines, etc., where there's a theory that you can actually reduce or eliminate a diastasis after pregnancy with exercise and diet. I am confident in saying that after 4,000 tummy tucks, there is not one diastasis that I've seen improved through diet and exercise. I have Olympic caliber athletes in my practice, professional female athletes who exercise religiously, and they still have a diastasis. And what you see here is a very fit patient who still has a diastasis. She's low body fat, she does core regularly, etc. But this is the problem. Here's her C-section scar, and the scar extends from here to here. And it's a pretty sizable scar. It's placed low, so the obstetrician did a great job of trying to put this in a place where it would be concealed and minimally objectionable to the patient. So when we do a mini tuck, the incision is actually just slightly lower, so I can remove that scar, and slightly longer. So here is her proposed incision. I'm going to draw in some of these muscles so so that you can sort of get an understanding of what's really happening here. So with this incision, I'm going to lift the skin off of the fascia, off of the rectus fascia, all the way to the costal margin, which is right about there. When I get to the umbilicus, I'm going to actually release it from where it exits through the fascia, okay? Or what is the diastasis. At this time, there's really no fascia or no muscle there. Once I do that, I'll be able to pull this down quite a bit. And what I'm proposing is to remove about this much skin. So this will eventually be pulled all the way down to here. Now when I do that, it's going to actually make the umbilicus, the belly button, come down a little bit, maybe 1.5 centimeters, 2 centimeters. But visually, that won't be objectionable because she's at or slightly higher than the midpoint. In a patient who has a low set belly button, this can be a problem because it'll drop too much. In that patient, you'll probably require a counter incision and more of a traditional standard tummy tuck. So after lifting this up, the costal margin, releasing the umbilicus by releasing the stalk and pulling this down, I will grab the stalk from underneath and re-inset it into the fascia after I've repaired this diastasis. Diastasis repair. We'll start from the xiphoid process right here and come all the way down to her pelvic bone. So these are the steps once again. Create this low, limited incision, raise the skin off of the rectus fascia, release the umbilical stalk, take this all the way up to the costal margin. Do the repair of the diastasis. Bring this flap down, re-inset the umbilicus, which will improve the appearance and make it an innie once again. And then finish by approximating the two skin edges. And that'll give us the result that we want, which will be a repaired diastasis, increased abdominal support, an improved appearance of her belly button, and a very, very low scar, which is only slightly bigger than her original C-section scar. So next, we'll go to the operating room and show you how this is actually done.